Hi, I'm Sue Woods, currently the president of the Society for Participatory Medicine. This is a nonprofit organization that has a tremendous amount of passion for patient-clinician partnership. And it's really the passion and the movement that really attracted me to its mission. So our mission is to promote the partnership for patients and clinicians, patient advocacy and patient empowerment, so that clinicians and healthcare systems learn from patients who contribute to their own care and their own health, and create that partnership, to also be able to bring in and promote the use of really good, meaningful digital tools to help people manage their own health and to help that partnership. As a leader in the society, we are an all-voluntary organization, and so the leadership as a group is really the ones who roll up their sleeves and do the work and drive the efforts. We had an amazing second annual conference a couple days ago that was incredibly well attended as a part of a pre-conference for the Connected Health Conference, and we worked diligently on putting that together. You know, SPM is one of the most exciting organizations around. It's probably and maybe the only organization that's comprised of both patients, patient advocates, clinicians, all kinds of clinicians, health system leaders, technologists, other stakeholders. So it's a very wide group of individuals who all share that same vision and passion. People who join the society do it because they want to drive that agenda and drive that vision, so they're very focused on connecting with people with a shared vision. They also want to drive particular things. So for example, advocacy around open notes, patients getting access to their own clinical notes and doctor notes and not having to go and cut up their little finger to get copies of their records and pay, to bring in these tools that allow people to really play a really important role in their own care. So it's really people who want to drive that, have that vision and really want to drive that mission. I have been in healthcare a long time, in public and private settings, academic settings. I became focused on the technology about 15 years ago because I think there's a paradox to technology if used correctly and if used meaningfully. And instead of what people think keeps you away from people and is cold and not personal, it actually improves the relationship. So if I'm a primary care doc, and if I promote and encourage patients to use open notes and secure messaging and peer-to-peer online resources and going into the internet and doing everything that they can do to inform themselves, we have a better relationship. I know that person more and better than I would if those things hadn't been encouraged. So again, it's really important for healthcare to understand what a powerful role patients and families have in contributing to their own health. It's also important for us to be driving really great tools that help people both take care of themselves and have that really great partnership. I mean, there's people at this conference who are really pioneers in developing these tools, driving these tools. My own personal experience, I spent over 10 years at the VA, and a lot of people have a very narrow view of the VA. If they don't know about it, they sort of read about it or hear about it on TV. But they pioneered the first electronic record in the 90s. They've been doing innovation, and they're really out in the front and center using connected care technologies, telehealth. They opened notes in 2013, and I was privileged to be part of that leadership, and those are the people who really have continue to stimulate my drive and my desire to be part of this movement. I would encourage everybody, if they don't know about the Society for Participatory Medicine, to go to our website at participatorymedicine.org, learn about it, join. We have a very low barrier to become a member. Right now it's $25 for the year. Normally it's $50. That's a pretty small amount compared to other organizations. And if that's even too much, if you're a patient, if you're an advocate, let us know, because we want you to be a member and join our society. I am in Portland, Maine. You can find me on Twitter at Sue Woods, SUEWOODS, or on LinkedIn, or at the Society website.